Hello, my name is Rosalind and this is an EFT tap-along video. It will allow you to use emotional freedom techniques very simply and also to address a specific aspect of recovering emotionally after a miscarriage. The topic of this particular video is how to make it easier to cope at work after a miscarriage. Now we've reached the part which you'll find in all of my videos where I say you must take full responsibility for your own well-being as we tap. And that's because with the tapping, it can be a bit like peeling the layers off an onion and stuff can come up. So if you've been suppressing emotions or under the care of a doctor, or if you've been seeing a therapist, or if you suspect that maybe you should be, then you might like to consult someone before you proceed with this. Or at least do make sure that you have someone with you to support you as you tap. And it's very rare that this happens, and if, as we tap, unpleasant emotions do come up, the chances are that they can begin to ease as we continue to tap. Okay, so the topic of this particular video is how to make it easier to cope at work after a miscarriage. So it's quite possible that you may have gone back to work relatively soon after a miscarriage. Physically, you may be coping very well and you may be quite capable of being back at work, but emotionally you may still be reeling, and it can be very difficult to go back to work after a miscarriage, and you may not feel like yourself at all. And there are 4 things which I wanted to let you know about very briefly, because many of my clients find that they find it easier when they do know about these things. So there's been research carried out at a university in Philadelphia, and the first thing that they've discovered is that typically it takes about 4 months for a woman to feel back to normal again after a miscarriage. Somewhere between 4 to 6 months. Now that's a lot longer than most people would realise, so if you are somewhere in that 4 months, that 4 to 6 months, and you don't feel back to normal yet, then that is completely usual. There's nothing wrong with you, it will get better with time. The second thing that the research showed was that the intensity of the level of grief that a woman can feel after a miscarriage can be equivalent to that of having lost somebody close to you who was walking around in your life. So it can actually match. The amount of grief that you're feeling can match the amount that you would have if you'd lost somebody close to you who'd been walking around in your life. Now again, I think many people don't have any idea about that, and it may be, particularly if you work in a particularly male environment, that people really don't understand. They may not appreciate this, they may not have any compassion for that. So if you are experiencing strong emotions and a lot of grief, that's also very normal, and that will also subside as well. Now the third thing which you may not realise, which may be going on for you, is that if you have been experiencing particularly unpleasant events in the process of a miscarriage, or if any of it was traumatic, then that can also be influencing how well you feel that you're able to cope at work afterwards. And there are techniques which are available for dealing with unpleasant memories. So depending on what you experienced before your miscarriage, if you, in the years or months beforehand, if you had experienced other unpleasant events or losses or bereavements or traumas, then it could be that that's just all adding up, that it's sort of amplifying those feelings, and it may be that it's got to a point where it's very difficult to deal with. And so what I wanted to let you know is that there are techniques which you can use to take away the unpleasant emotions which are attached to upsetting memories, and it's completely possible to do that. And again, I think many people don't realise that. And so one of the techniques you can use, which we're going to use in this video, is EFT, the tapping, emotional freedom techniques. And particularly if you work with an expert who knows what they're doing, somebody who's experienced, then they can guide you through the whole process and take care of you and make sure that it's as painless as possible, and it is possible to make the unpleasant emotions, the strong emotions which are attached to unpleasant memories, diminish and subside and go away. So the purpose of this particular video is not to do that. We're not aiming to take away unpleasant memories, but what I am hoping is that in the course of tapping we can help to ease some of the stronger feelings you might have at the moment. Typically people feel calmer and more peaceful as a result of tapping. But if you actually do need support with dealing with specific unpleasant memories, then I strongly recommend that you talk to an experienced EFT practitioner. Okay, so in a moment I'm going to ask you to copy what I do and to tap where I tap and repeat what I say, and we'll actually do some EFT together. Now, don't worry that if the words I ask you to repeat don't reflect exactly how you're feeling right now. You can repeat them anyway and you'll get all of the benefit of the tapping. So don't worry if they don't match exactly. However, if you would like to change them so that they do match exactly what you're feeling, don't feel that you have to repeat what I say. Do please feel free to change the words. So I might say, I feel sad, but you might want to say, I feel very sad, or perhaps I feel numb, or whatever it is. So do feel free to change the words so that they're reflecting exactly how you're feeling if you'd like to do that, but there's no requirement to. You could just repeat exactly what I say if you want to, and that will work very well. Okay? So let's begin tapping then. So I'm going to ask you to copy me, to repeat what I say, and to tap where I tap. Even though I've had a miscarriage and I'm finding it hard to cope at work, I am okay, even if I don't feel okay. And I know I'm doing my best. Even though I had a miscarriage and I'm finding it hard to be back at work, I might be finding it hard to cope there, I am okay, even if I don't feel okay. And I will feel okay eventually. And I'm doing my best. Even though I've had a miscarriage and I'm finding it hard to deal with it at work, I know I'm doing my best, even if that doesn't feel good enough sometimes. And I am okay. And I will feel okay eventually. And I'm doing my best. I've had a miscarriage. And I have all of these feelings and all of these emotions. And sometimes it's hard to cope at work. And maybe I don't feel like myself. And maybe I need to feel in control. Maybe I need to feel in control of my emotions. Maybe it's hard for me to work when I feel like this. And maybe I'm not used to this. Maybe I'm struggling to cope with it. Maybe I wonder if it will ever go away. Maybe I feel as if I have to hide it. And it's making it harder to work. And maybe it's hard enough doing my work anyway. And I don't feel myself. And I don't feel 100%. I am okay. Even if I don't feel okay. Okay, let's pause and take a deep breath. And let's continue to tap. Even though I'm going through this, and I have been through all of this, and I don't feel normal, and I don't feel like myself, I am okay, even if I don't feel okay. And I'm a good person, and I know I'm trying to do my best, even if it doesn't feel good enough. Even though I've been through all of this, and I am still going through it, and I don't feel like myself, and sometimes it's hard to cope, and it feels as if it's affecting my work, I am okay. And I will be okay again eventually. even though I've been through all of this and I don't feel normal and I don't feel like myself, and it's hard for me to work sometimes and it's interfering, I am okay. And I will be okay again eventually. I don't feel like myself. I didn't feel like this before. Maybe I'm wondering if I'm ever going to get over it. I don't feel like myself. Sometimes it interferes with my work. Maybe I feel distracted. Maybe I don't feel fully here. Maybe I wonder what the point of being here is sometimes. Maybe I don't feel connected to my work in the way that I used to. Maybe it feels a bit futile. Maybe I just don't feel engaged. And compared to what I've been through, maybe it doesn't feel important right now. And maybe I think I shouldn't be feeling like this. And I'm going through a period of adjustment and a grieving process. And it's normal not to feel normal at this point. And I'm doing my best, even if that doesn't feel good enough sometimes. Okay, let's pause and take another deep breath. Even though things might happen which distract me when I'm at work, I'm okay. And I'm doing my best, even if that doesn't feel good enough. Even though I might feel tearful sometimes, I might feel distracted, I might have strong emotions, thoughts might get in the way, I might feel as if I've got an invisible wound that nobody can see. I am okay, and I will be okay again, even if I don't feel okay now. And time will heal. Even though I might feel tearful, I might feel distracted, I might have strong emotions sometimes, and thoughts might get in the way, and it might feel as if I have an invisible wound that other people can't see. I am okay, even if I don't feel okay. And I will feel okay again eventually. I might be finding it hard to concentrate. I may not feel like myself. I might feel tearful sometimes. I might feel distracted. Thoughts might come up. Memories might come up. Emotions might come up. It might feel as if I have an invisible wound that other people can't see. Sometimes it might be hard to be there. Sometimes it might be hard to concentrate. Maybe I'm worried that it won't go away. Maybe I'm worried I'm never going to feel like myself again. And I choose to remember that this does take time. This is a grieving process. It has different stages. And I will come through it eventually. And if, for whatever reason, I feel stuck, I can seek support. And it is available. I have all these thoughts. I have these feelings. Maybe I feel tearful sometimes. Maybe I feel distracted sometimes. Maybe thoughts and memories come up sometimes. It is okay. They will pass eventually. Doesn't mean I can't do my job. I will come through this. It takes time. And I will be okay. Okay, let's pause and take another deep breath. Even though I may feel as if I have to be strong and I can't let any of this show, and that might be an effort, I am okay, even if I don't feel okay at the moment. And I will be okay. Even though I might feel as if I have to be strong and that I shouldn't let this show, I know I'm doing my best and that this will pass with time and I will heal. Even though I might feel as if I have to be strong and I mustn't let anybody see this. And maybe there's no understanding of what I'm going through. I am okay. And I choose to have compassion for myself and to recognize that this takes time, that I can do this, and it will pass, and I am okay. I might feel I have to be strong. Maybe I'm used to being strong. Maybe I don't feel strong right now. Maybe I'm wondering if I'll ever feel normal again. I might be feeling anxious. I may not feel in control of my emotions. Maybe I feel ambushed by my emotions sometimes. I don't feel like myself all of the time. Maybe I feel pressured to be over this by now. Maybe I'm trying to look as if I am. It's okay for me not to be over this by now. Research shows that most women don't feel normal for at least 4 months. There may be no understanding of this where I work. It doesn't mean that there's anything wrong with me. And chances are it will get easier with time. And if for whatever reason it doesn't, then it's possible I can seek support. I can get help from an expert. I am allowed to do that. I don't have to struggle on my own. I can do whatever I need to be supported. And I can talk to family and friends if that helps. And I could tap if that helps. I could do simple tapping. Simple tapping's on my website, by the way. I could watch some of these videos. I can seek support if it's helpful. And I don't have to. And I may not need to. But I can recognise that it's usual for it to take time to get over this. And if I'm not there yet, that's normal. And time will heal. And I will feel okay again eventually. Okay, let's pause and take another deep breath. Even though it might feel as if other people think I should be over this by now. Maybe they think I should pull myself together. Maybe I think that. It doesn't mean it's true. This takes time. And I can have compassion for what I'm going through. And maybe cut myself some slack. And maybe be less judgmental. And I'm okay. And I'm doing my best. Even if it doesn't feel like it sometimes. Even though it may be that I think I should be over this by now. That I should be able to pull myself together. It may be that I think others think that. Doesn't mean it's true. The research shows that it takes time. And I can take the time I need to recover. And I can use self-help techniques if that helps me. And if I need to, I can seek support. And I will be okay. And I am okay. Maybe I think I should be over it by now. Maybe other people think I should be. Maybe I'm judging myself. Maybe I'm feeling judged. Maybe I look fine from the outside. But I don't feel fine inside. And I choose to remember that time heals. And this is a grieving process. Most women don't feel normal again for 4 to 6 months. And it's okay if the emotions are strong. For many people, losing a baby causes as much grief as if I'd lost someone close to me. And the research shows that. Even if the people around me have no idea. It's okay to be upset. It's okay to grieve. It's okay to feel emotional sometimes. This is a grieving process, and it will pass. And I will feel like myself again eventually. And if for whatever reason I feel stuck, I can seek support. It is out there. I don't have to struggle and suffer on my own. And I can get through this. And I choose to have compassion for what I'm experiencing. And I'm open to the possibility that I can be kind and gentle to myself. That I can take care of myself. And that this will pass. And that I will be okay again. Okay, let's pause and take another deep breath. Okay, well thank you very much indeed for taking the time to tap with me. I hope you're feeling a little bit better now than when we began. If you would like to see other videos, or if you'd like to know what else I can offer, or if you'd like to know how I could help you individually, wherever you are in the world, do please look at my website. It's www.miscarriage-support.com, and do please take good care of yourself, and I hope to see you again. Thank you.